Not only are we facing the biggest reorganisation in the history of the NHS and Social Care Bill, but at the same time we are being asked to save or create efficiencies of £20 billion over 4 years. Now, £20 billion is about 20% of the whole NHS budget, but for the English NHS, and this bill only applies to England, it's more like 25% of the total spend on the NHS. So the first thing to say is that whereas the government is saying that this is going to be better for patients, it is not, because there are going to be huge reductions in what the NHS provides. GPs will, in the new scheme, become responsible in these GP consortia for administering a large chunk of the NHS budget for England. A lot of GPs are fooled and they think that they will have an enormous amount of power. They will be able to redesign services and create a better health service for patients. But the reality is different. The reality is that they will be responsible for administering the cuts. The second thing about this bill is that it represents a sea change in the way business is done within the NHS, because what they want to do is introduce competition. And there's an organisation called Monitor that is going to grow from its current function, which is to look after some of the foundation trusts, and it's going to become responsible for making sure that every GP helps competition within the NHS. And that means the private sector will grow, the private sector will be enabled to cherry pick the services that are easiest to make a profit from. And so that will be another attack, not only on the NHS budget, which will have to pay for the service and pay for the profits that the private companies have to make, but also it will represent a fragmentation of the service that you and I will receive from the NHS. Instead of me as a GP relating to my local hospital, I will now have to relate to multiple organisations in the private sector, the voluntary sector and so on, who will be competing with each other to get the attention of GPs and to get money spent on the service that they think is important. So any idea of using the NHS and modifying the NHS and improving the NHS to improve services for you is something that is going to be extremely difficult under this new bill. One of the questions that we've asked government is, why are they reorganising the NHS at this moment? Recently, the NHS had its highest rating ever from the public in terms of satisfaction with the NHS. The statistics of the NHS with regard to cancer survival rates, heart disease and so on are improving. They are not getting worse. So we said, well, what is this reorganisation about? And it's quite clear that the main reason for this organisation is to create a market in the NHS in England. One of the effects of having a market in healthcare and GPs at the centre of that market is that the relationship between patients and their GP is at risk. Because the NHS is there to provide care for all of us when we need it, there's no doubt that when you see your GP, if you're in need, you have a discussion about how that healthcare need can be met. And if the GP suggests referral to the local hospital or a specialist hospital, then patients will accept the word of their GP and take their advice. Things will change, because as the NHS provides less, GPs will be less able to offer you referral for your health problems. They will be under pressure from their GP consortia to keep a lid on the need to refer patients to hospital, because GPs will be responsible for keeping within budget in the NHS. Also, a lot of GPs are going to be involved with the private companies that are going to be encouraged to provide services to the NHS. And it could be that you're sat with a GP who is a member of the consortia committee, who also runs a private hospital or has involvement with other private services, and you will never quite know whether what the GP is suggesting is in your interest, is in the interest of the GP consortia or is in the personal interest of the GP and their relationship to a private company. This fundamentally undermines and changes the way in which patients relate to their GP and the high trust with which most GPs are held by the public. A couple of years ago there was a lot of attention in the media because some patients in some areas were able to get drugs for cancer or drugs for infertility treatment, whereas in other parts of the country they were not, and it was called postcode lottery. The government says that new reforms will reduce the amount of variation between what is provided by the NHS, but the truth is that the opposite, of course, is going to happen, because they're going to set up these GP consortia, which are going to be relatively small organisations, at least to begin with, and they are going to decide what services they're going to provide for their population. The government says that GPs are very close to the population that they serve, they know their population very well, which is true, and therefore they will be better able to design services locally for patients. Well, I challenge that, because small populations mean that you have a great difficulty in using your budget efficiently, because you've only got to have a family in a car crash and going into intensive care and your budget will come under severe strain. So it's not straightforward. It's not as simple as the government says, that we give GPs the money and there'll be local services and everybody will be happy. It won't be like that. And because these organisations are small and because there are so many of them, then there will be great differences between what is provided in each area. And I can see people even moving because the consortia, GP consortia down the road, offers a better range of services than the consortia for the area in which they live. And it'll become the same sort of story as trying to get your children into a decent school. One of the key parts of the bill is that there will be competition between all sorts of people trying to provide services for the NHS. Now there's a worry that the private sector, who basically are there to make a profit rather than to provide services for the population, will cherry pick the easiest parts of healthcare because they're the quickest ways to make money out of the NHS. And that means that the more complicated care, and indeed the patients that suffer complications in the private sector, will be moved into the NHS, and the NHS will be left with the more complex, the more difficult, and therefore the more expensive patients to look after. That means that this competition will fundamentally undermine the ability of NHS hospitals to cope financially, because NHS hospitals at the moment cross-subsidise. They do some of the simple work for which they get paid in order to subsidise the expensive work, the difficult work that we rely on them to do. So competition in healthcare is known throughout the world to produce lower quality and a poorer service, because everybody is competing together instead of cooperating. Okay. There's been a lot of focus on the NHS reforms around GP consortia. What people are not so clear about and fail to understand is what is planned for our hospitals. At the moment, a small number of hospitals are what are called foundation trusts, and they are separate from the NHS. They are allowed to gamble on the stock exchange, they're allowed to borrow money from various sources, and they are very much an independent business. The intention of this bill, the law will change so that every hospital has to become a foundation trust. And that means that there will be mergers of smaller hospitals and probably some closures of hospitals that can't make it to trust status, to foundation trust status. One of the freedoms that these foundation trusts have is that they can generate money by offering services to private patients. There is a cap on the amount of money that they can make offering services to private patients currently, and that cap is to be abolished under the new bill, so that foundation trusts, NHS organisations, will be able to advertise themselves and to provide as much attention and care and as many services as they like to private patients. And it's obvious that if they get strapped for cash, as they inevitably will do because of the £20 billion of savings or efficiencies that are planned, then the temptation will be for them to generate income, to fill the budget by providing more services for private patients. And that means less services for NHS patients. So we will see waiting lists grow. We will see patients being pushed ahead of NHS patients because they're paying privately. And there will be a huge pressure on people in pain from hip problems or knee problems to use their own money to join the private queue, which will be shorter, rather than the NHS queue, which will be longer. This reorganisation, the biggest that the NHS has ever undergone in its 62-year history, was something that came completely out of the blue. There was a line in the Conservative Party manifesto which said that they wanted GPs to become involved in shaping NHS services, and who could disagree with that? But there was nothing in the coalition agreement that foreshadowed what is planned for the NHS in terms of its reorganisation. In fact, the opposite. The Prime Minister said there would be no top-down reorganisation of the NHS, and yet that is what we're going to have in spades. And so my accusation is very direct. They lied about the NHS, because we know that the Secretary of State for Health, Andrew Lansley, has been planning this move for 5 years. But it is such a destructive move on the NHS that he had to keep it secret. He wasn't able to put it boldly in the manifesto. He wasn't able to put it in the coalition agreement, and he announced it within a few weeks of taking office as Secretary of State. So no one has voted for these changes because no one knew about them, and that is something that is totally unacceptable. We all have a responsibility, and I would say a duty, to stand up and defend the NHS, not because it's the best service in the world, but because it offers the best security for all of us, because we know it's there when we need it. That may no longer be true. And there is a well-known quote that the NHS will last as long as there are people willing to stand up and fight for it. And it's our turn to fight for the NHS now.